Good afternoon, and thank you very much for inviting me to speak. Now, we've heard lots of great ideas, innovation, whether it's being used, the thingy, My Dart, whether it's use of staffing differently, use of volunteers. I've been invited to talk about friends and family and the challenges of some of those things. Now, sadly, the encrypted NHS memory stick is so encrypted that Swift, it won't let me in. So I've got, yes, it's quite wise. I'm from the Shire, so it's probably quite wise. So you'll get a copy of the presentation. There's a few photos, but most of it is really about some of the challenges around friends and families. Now, I expect sitting in the room, there's quite a few of you who will have lots of idea about what friends and family is, and some of you have come up with very innovative ways of addressing some of the feedback and trying to get feedback. Well, we met Fiona demonstrating the thingy in our trust, and one thing that was really captured me was the way that users could give feedback on how they were feeling pre and post the session, and that was really, really good. I then started having conversations with Fiona that actually the concept is really, really good, and we're all suffering from this challenge of how do we get feedback, how do we try and get feedback from whatever service we use under friends and family, because obviously with the changes earlier in this year where everybody used to use the little token things, yeah, and then we weren't allowed to use those. We had to give the availability of using comments, and then if we ask the audience, there'll be people who are using paper, cards, QI codes. I'm trying to be whizzy with those out of focus squares that you can scan with your phone. Text messaging, whether it's we text them or they can text in. And it provides us with this massive challenge of trying to get feedback on our services from those who are using our services. So we spoke with Fiona and about developing an extended version of that sort of user feedback. And we developed a friends and family test using the same system. So I'm not going to be talking to you about dementia. So I'm probably the only speaker on a dementia conference who's not speaking about dementia. So it sits right in the front of our A&E department. My biggest fear was somebody was going to steal it, but it has stood the test of time. So traditionally we would use business cards. We tried giving them to everybody as they booked into A&E, give them a free pen as well. And we really suffered really badly with trying to get people to respond, and we had really, really poor response rates. So we thought, okay, not a problem, we're going to put a text message so they could text us how they're feeling in the waiting room, or those who have used our service. We still didn't get a very good response. Now, some emergency departments and some other sort of different specialities are texting people who have used your service. We haven't gone down that route as yet, mainly because I think there's a cost involved in it. And I'm just concerned that we'll end up texting somebody inappropriately after they've used our service and sort of making that situation a lot worse and harder for them to deal with. So we've developed the friends and family test using the same thingy screen. I don't know whether that's the correct term, but the new term, we'll call it thingy. And we put it right beside the entrance. Now, on average, in the few months preceding the trial period, which is literally, this is very, very new, so it's about 10 days. It's been with the Trust for about 3 weeks, but it has to go through all the tests which the Trust insist on. We were ranging between about 3.5% return rate with all these different methods we were trialling to light duties. So the last couple of months we've had a few staff on lighter duties, so it brought it up to about 10%. In the 10 days that the thingy has been in operation, which is a basic smiley faces, like when you go to an airport, you tap it, it then gives you the opportunity to leave comments and feedback on the different questions asked. We dictate the questions, the software enables you to ask whatever questions you want. If they choose to leave feedback, they can. If they don't, they don't have to. Our response rate is 14%, which is the highest it's ever been. So depending on, whether we are, I've not touched anything. Depending on the numbers, it's an increase of around about 11.5% up to 5%. So it's a dramatic increase. The benefit of that data, though, is rather than just having a green coin and whether it's extremely likely, unlikely, is very often whatever method you use, it's really hard to get rich data. So we've had 450 responses in the last 10 days, and it's provided us absolute loads of data. So we know that it's day or night where this feedback has been given. Is it a weekday, a weekend? We can have positive comments, so we can trace that to the staff. Our negative comments, we can look at, now is that to do with the pressure within the department? Is it to do with poor staffing on the department? Is it an individual that perhaps we know is, under management and we've now got feedback? Or is there something that's gone on shift and actually we need to support our staff because actually clearly something went on with this feedback and the staff hasn't brought it to our attention, so do we need to support our staff? So it's sort of a two-sided tool now, and providing real quality rich data that we can follow this up, and it's not just about whether they like our service or not, it's about whether it was good, whether it was bad. If it was bad, why was it bad? Is it just waiting time? Is it standards of care? Or is it that it was an individual and an interaction problem? So actually the feedback we're getting now is quality rather than yes, no, extremely likely, extremely unlikely. And they don't need a pen. It's quick, it's easy. We've got, we're Suffolk, so as I say, I'm from the Shire. So it's, we have got quite an elderly population, as most people have in their catchment area, as well as the very young. And we've tried everything, but this is the single thing that we've used that's had the most dramatic impact.